And it is a privilege and a pleasure to welcome you here at the McGill University Health Centre, to the Royal Victoria Hospital, for Hans Paul's incredible evening, and we're very proud to be associated with what Hans Paul is doing. Let me take a moment and recognize a few friends in the room. Dr. Henry Shibata, surgical oncologist, our chairman emeritus. Henry is here. He was our first fellow of Cedars in 1967. And we're so proud to have Dr. Shibata with us here tonight. And he's also Professor Emeritus at McGill in Oncology. Thank you for coming, Dr. Shibata. Dr. Mark Hamel, Director of the MUHC Psychosocial Oncology Program. Mark, you can wave. Dr. Alana Pratt, another psychologist in psychosocial oncology. We're very happy to have you with us. Tonight you'll learn and you'll meet the founder and the director of Cedars Cancer Support. And I'm going to allow Hans Paul to introduce Mrs. Gwen Andrews-Nakos. But Gwen is an inspiration to all of us. She founded Cancer Support more than 23 years ago when she was had her own cancer journey, and she'll tell you about that shortly. I'd like to also recognize Mrs. Lorena Cook. I know Lorena's here. And Lorena's one of the founding chairs of the Sarah's Fund in Pediatric Oncology. Her daughters are inspiration for pediatric hematology oncology, our fund helping children with cancer. But ladies and gentlemen, why are we here tonight? Hans Paul has brought us all here tonight. And this young man is our inspiration. If you allow me, I'll take a few moments and tell you about Hans Paul, and then I'll pass the torch to him. But in March of 2009, 3 days before his 27th birthday, Hans Paul was diagnosed with Hodgkin's lymphoma. A cancer diagnosis is not easy. The cancer journey is not easy. It's not easy for the individual, for the family members, for the community. And Hans Paul faced this challenge head on, and he was touched by Cedars Cancer Support, by the services and programs that we offer here at the hospital, that Gwen and Gwyneth as well. Gwyneth will also be, I'll introduce you, our interim director of the cancer program, Gwyneth Gorman. She's also here. Gwyneth, there you are. And she'll speak later. And Hans Paul was touched about some of the programs that we offer. And he wanted to do something to give back. And you know, today we see at Cedars, we're a grassroots, hospital-based charity. And we're comprehensive. Our mission is from pediatric oncology for the youngest of cancer patients, through adolescents and young adults, through adult care, through to palliative care. The full spectrum of life. And we have a very simple mission. We raise money, private dollars, for four things. For cancer care, for cancer research, for cancer education, and for cancer equipment. Trying to buy the best equipment for our practitioners to help our patients and their families. So Hans Paul faced it head on, and I hope you've gone to his Cancertainly.com blog. And during his cancer journey, he started to put his thoughts down, and he wanted to help others. And that, ladies and gentlemen, is an inspiration. To want to help others, to help them on their road, their cancer journey. This young man has done an incredible job, and I encourage you all to go online and read his blog and see his thoughts. And Cedars is so proud to be associated, to see what he's doing, bringing us together, and it's awareness, it's dollars, it's the programs that you're going to learn about tonight that we offer. And without further ado, it's my privilege and honor to introduce our guest of honor tonight, who's brought us all together, Hans Paul. Please come forward.